Oppositional defiant disorder isn't just for children. It is a very real condition affecting adults. In fact, over 10% of adults will experience it in their lifetime, yet it's often completely missed. So why is this condition so hidden? Because its symptoms are almost always dismissed as personality flaws. It gets labeled as stubbornness, arrogance, or just being a difficult person, missing the root cause. In this video, we'll break down the real signs, its hidden impact, and the proven pathways to treatment. Adult ODD centers on three core behavioral patterns: a persistently angry mood, argumentative behavior, and vindictiveness. This isn't just disagreeing. It's actively challenging authority. It's refusing to follow rules. It's deliberately annoying people. The vindictive part is critical. This can escalate to spreading rumors, social sabotage, or seeking revenge for minor slights. Significantly, ODD rarely comes alone. Over 90% of people with a history of ODD will have at least one other mental illness. So, we see these external behaviors, but what is the internal experience like? This is the key to understanding the disorder. Many adults with ODD don't see themselves as defiant. They feel like victims. They feel misunderstood, disliked, or unfairly cornered. Their oppositional behavior is a reaction to this internal state of feeling wronged. It's a destructive defense mechanism. That constant irritability is a huge clue. It's not a bad mood. It's a sign of deep emotional dysregulation, often linked to depression and anxiety. Clinicians often call ODD a fever, a clear sign something is wrong, but not the illness itself. So what is the underlying illness causing it? Before we answer that, let's see the devastating domino effect this fever has on an adult's life. The consequences are severe. In the workplace, ODD can be professionally catastrophic, showing up as chronic conflict, resisting feedback, and frequent job changes. Personal relationships suffer immensely. Research shows a direct line between ODD symptoms and failed romantic relationships and friendships. Left untreated, the long-term risks are dire: antisocial personality disorder, substance abuse, and even an increased risk of suicide. The stakes are incredibly high, which makes a correct diagnosis vital. But getting one is where things get exceptionally difficult. Remember the fever? The underlying illness is often a tangled web of other conditions that are hard to isolate from one another. Is the opposition from ADHD impulsivity? Is the irritability from depression or bipolar disorder? A clinician must untangle these threads. Take narcissistic personality disorder. Both involve conflict. But ODD is driven by irritability. NPD is driven by grandiosity. This is why a simple checklist is never enough. Diagnosing adult ODD requires a full psychiatric evaluation to map out every co-occurring condition. So if ODD is this tangled knot of symptoms, how do you begin to treat it? The approach has to be just as nuanced as the diagnosis. Let's connect the dots. That 90% comorbidity rate and the fever analogy? That's why there's no ODD pill. You treat the infection, not the fever. Medications manage co-occurring conditions like stimulants for ADHD or SSRIs for anxiety. Treating these can lessen the ODD symptoms. The primary treatment, however, is therapy. Cognitive behavioral therapy, or CBT, is highly effective for targeting the defiant thought patterns. Remember how adults with ODD feel like victims? CBT helps them identify, challenge, and reframe those thoughts for less oppositional responses. And because of the severe damage to relationships, interpersonal or couples counseling is often a necessary part of a successful treatment plan. Treatment provides the tools, but daily life is where change is made. So what can an individual do to manage symptoms day to day? Self-management is vital. Mindfulness to spot triggers. Journaling to track emotional patterns. Learning specific conflict resolution skills. Let's bring it all together. Adult oppositional defiant disorder is not a choice or a simple personality flaw. It's a misunderstood condition. But despite its difficulty, it can be diagnosed accurately. And through a targeted approach of therapy and management, it is treatable. Understanding is the first step. Recognizing these patterns, in yourself or another, removes blame and opens the door to real solutions. If any of this sounded familiar, the most important action is to seek a full evaluation from a qualified mental health professional.